Hello everyone, welcome to my channel. Today I am going to take another topic of pharmacology, that is local anesthetic. Very commonly asked question from this topic is classify local anesthetic, write its mechanism of action, write its therapeutic uses or various techniques of local anesthetic. So in today's video I am going to mainly cover the mechanism of action of local anesthetic and what are the various factors which are going to affect its action. So let's get started with the topic local anesthetic. So what are the local anesthetic? They are the agent which is going to cause the numbness, which is going to numb an area of the body. जहाँ पे भी आप देते हो उसको वो numb कर देता है, numb an area of the body so that any surgery, आपको कोई भी surgery करनी, any surgery or procedure can be done without patient feeling any pain. Can be done without the person or patient feeling any pain. Now, what is the thing which is going to trigger the pain? So, pain can be triggered by the mechanical, chemical or thermal. किसी भी तरह से ये we can trigger the pain. Mechanical, chemical or thermal. So, pain, it is an unpleasant emotional state or emotional response of the person which is followed by any tissue damage. So, to make you understand how the local anesthetic drug they act, first you must know what are the things which are going to carry this pain, because they are going to numb an area so that patient should not feel any pain. Suppose we are giving a prick to a person. You can see here a needle, we are giving a prick to a person. Then what will happen with this prick? With this prick, it is going to carry this sensation through the nerve, and where it will relate to the spinal cord, and all of you know which tract is going to carry the pain, that is spinothalamic tract. This is the one which is going to carry this pain sensation from this spinal cord, where it will be related to the thalamus. This is the sorting center which is going to sort out from where exactly the patient is feeling the pain. Now, which nerve fiber, ये जो nerve बनाई है यहाँ पे, which nerve fiber they are going to carry the pain? It is A delta and C fiber. The sharp pain that is carried by A delta, whereas the dull pain that is carried by the C fiber. Now, how this transmission of the pain that happens? ये transmission कैसे होगी? It is through this nerve A delta and C fiber, but how this pain it is transmitted? It is by the generation of the action potential. Now, how this action potential it is generated in this nerve fiber? So, in the nerve fiber, there are again various channel protein. They are there, like sodium channel, they are there, potassium channel is there, chloride channel is there. एक simple सा box है, just we have drawn it in a enlarged form. Let's see the various channel protein what are there. So this is the nerve fiber, this is outside, and this is the inside exoplasm that is there. So as in other cell, here also the potassium ion that is in the higher concentration as compared to the sodium ion. So these channel, these are the sodium channel. ये जो बनाए ये आपके sodium channel है. So what will happen once it is going to cross the threshold depolarization? With the threshold depolarization, what will happen? These channel protein which are in a resting phase, they get activated. ये आपका resting phase है, they get activated. Once they get activated, then what will happen? There is an influx of the sodium ion. Once this sodium ion it enters within the cell, then what will happen? The action potential that is generated because of the influx of the sodium ion. And what will happen? The depolarization will happen, and this is going to cause the pain. आपकी नर्व ये स्टिमुलेट होगी, depolarization, this is going to, यहाँ पे depolarization, this will be going to carry the pain. So pain transmission will be there through the spinothalamic tract. So this is how the pain transmission it happens because of the opening of activation of this sodium channel, influx of the sodium हुआ आपका, then depolarization of the nerve fiber and pain get transmitted. Now what the local anesthetic they are going to do on for this full pathway, where this local anesthetic they are going to interrupt this, ये वाला करता है, ये वाला ये किसको ये, it is going to hamper what. Let's see the next figure. This is I have taken from the standard textbook of the pharmacology, that is KD Tripathi. So you can see the sodium channel it exists. This is a structure of the mechanism of action बताया. This is a structure of the sodium channel. It exists in 3 phases: resting phase, activated phase and inactivated phase. So sodium channel in the resting phase, so it is having a 2 gate. This is M gate towards the outside, extracellular side पे आपका इसका एक gate है, and another one is a intracellular side. This is the exoplasm, this is outside and this is inside. So this is M gate and there is a H gate and the intracellular side. Now what will happen, you are giving, when you give the local anesthetic, what they are going to do this to this sodium channel. Local anesthetic, they are the weak base. Remember one thing, they are weak base, so they are present in both state, ionized as well as unionized state. ठीक है, ये दोनों में. Now you all know it is an unionized form which is a lipid soluble. So lipid soluble, this is the one which can cross the membrane. So sorry, this one is, it is unionized form. So this is a lipid soluble, it can cross the cell membrane. ये यहाँ पे जो दिखाया है, it is unionized form, it is going to cross the cell membrane. Now what will happen within the exoplasm? Within the exoplasm, now pH it is weak base है आपका, अंदर क्या है आपका mild acidic 7.4 pH. Now within the exoplasm it again gets ionized. Now on the intracellular side, here is the, within the sodium channel towards the intracellular side there is a local anesthetic receptor. ये वाला, ये yellow वाला, this is a local anesthetic receptor. It has got affinity mainly for the ionized fraction of the local anesthetic. So what happens, local anesthetic being a weak base, the unionized fraction that is going to cross within the exoplasm, it gets again ionized, and this ionized fraction it is going to bind to this receptor. ये आपका यहाँ पे receptor के साथ, once it binds with the receptor, so when it is going to bind when the channel is activated. जब आपका ये channel activated है, when the depolarization happens, then what will happen, this ionized fraction of the local anesthetic they come and bind with the receptor. Once it binds with the receptor, then what will happen, the channel it gets inactivated. So it is going to prolong the inactivation of the sodium channel. So local anesthetic they bind with the activated channel and it is going to cause the inactivation of the channel and it is going to prolong the inactivation state of the sodium channel. So it does not bind, यहाँ पे bind नहीं करती, it is going to bind here and it is going to prolong the inactivation of the sodium channel. This is how the local anesthetic they are going to act. So how you are going to write this local anesthetic mechanism of action? They are going to block the voltage gated sodium channel. So by blocking the voltage gated sodium channel, what will happen, this influx of the sodium ion, ये जो आपका sodium है, it will not enter within the exoplasm. ये अगर अंदर नहीं आएगा, then what will happen, there will be, if there is no influx of the sodium ion, अगर ये नहीं होगा आपका, then what will happen, if there is no influx, no depolarization, no pain transmission. So this is how the local anesthetic they are going to act. So they are going to block this influx of the sodium ion by making it the channel, prolonging its inactivation phase. So because for the next impulse, what will happen? The inactive channel, it has to come back to the resting phase, so that with the next impulse it again gets activated. This is how the local anesthetic drug they act. You can see here also, this is the normal action potential aapka. This is the normal action potential, this is a depolarization, and this is a repolarization. So this B, C, D, they are the different concentration of the local anesthetic. Okay? At a different local anesthetic concentration, what will happen? This depolarization, it is not happening. ये आपका देखो. So even it is at a higher concentration, it is not crossing. This is a threshold. ये आपका threshold है. So it is not crossing even the threshold. So at different concentration, as you increase the concentration of the local anesthetic, what will happen? It is not even going to cross this threshold voltage. So there is no depolarization, no transmission of the pain. This also I have taken it from the Tripathi. Then you can see here another way of writing. So this is a weak base local anesthetic. So what happens within the exoplasm when the pH it is 7.4, then what will happen? It will be in unionized and ionized form. It is an unionized form which can cross the nerve sheath. Nerve को enter कर जाएगी. Then what will happen? Within the exoplasm again, what will happen? Because of the decreased pH, it will be reionized again. So with the reionized, what will happen? The reionized, it is going to attach the, so already I have told it is the unionized fraction that is going to enter ये आपका B and BH. Unionized fraction that is going to enter. Then what will happen with the 7.4 pH? What this is again converted into ionized, and this is the one which is going to attach with the receptor, and once it binds with the receptor in the open state, it is going to make it inactive and prolong the inactivation state of the sodium channel, and there will be no further entry of the sodium, no depolarization, no transmission of the pain. So you can write any way, whatever you find convenient. So local anesthetic, what are the these drugs? So earlier definition I have told, they are the agent which is causing the numbness to an area, so that any surgery or any procedure can be done without the patient feeling any pain. Now this is a proper, what are the local anesthetic which upon topical or local injection, they are going to block the impulse generation and conduction and causes the reversible, this is very important, reversible loss of sensory perception in a restricted area of the body without causing any structural damage. तो reversible loss होगा जितनी देर तक आपने दिया, and again patient is going to recover it, and wherever you have applied in that particular area, there will be no sensation will be there, numbness will be there, and there will be no structural damage. Now you can see a few of the MCQ how you can get local anesthetic. So first choice is, first key is block the release of neurotransmitter. This is the first A. Then B is block the influx of the sodium ion into the cell. Increase the release of inhibitory neurotransmitter. Inhibit the efflux of the sodium ion from the neuron. So local anesthetic, how they are, which is the correct choice out of this? So they block the influx of the sodium into the cell. So this is the correct choice. So if you know the mechanism of action of the local anesthetic, it is very easy to solve this multiple choice question. Now another one is the mechanism. MOA is a mechanism of local action of local anesthetic is that they act on the sodium channel in what state? Activated में करता है, resting में करता है, inactivated or any state. So you know resting वाला तो बिल्कुल नहीं है. It mainly acts on the activated state, and it is going to prolong the inactivated state. पर act ये कब करता है? When the channel they are open. So this is the correct choice is activated state. So you can see, if you know the mechanism of action, you can solve the MCQ also. Then what are the factors which are going to affect the local anesthetic action? Like effect of pH. So you know they are the basic drug. So if you are going to increase the pH, then what will happen? If you are going to increase the pH, then it is going to increase the unionized. So basic drug in basic media will remain unionized. So unionized fraction, it is a lipid soluble, can cross the exoplasm and can act faster. So it is a lipid soluble. Then another one is the rate of diffusion. Rate of diffusion, it all depends on the concentration gradient. जितना ज़्यादा concentration होगा उतना rate of diffusion will be more. Then another one is the lipid solubility. So you know lipid solubility, that is, if it is a highly lipid soluble, then definitely it is can cross the axonal membrane, then can act faster. So lipid solubility, that is another factor. Now another important factor, that is a vasoconstrictor. So what is the vasoconstrictor? How they are going to affect the local anesthetic action? So vasoconstrictor, like if we give adrenaline along with the local, very commonly asked question is, you can see in the next slide, explain why local anesthetic they are given. Abhi isko chhod do, phalipesin is given along with the adrenaline. So why we give local anesthetic with the adrenaline? So adrenaline, it is a vasoconstrictor. So once you give this, so the advantages of this one is if we are going to give this, then what will happen? Because of the vasoconstrictor action of this, the local anesthetic, it will stay there. It will stay at the site for a longer time. So it is going to prolong the duration of action of, so we can write, it is going to prolong the duration of action of local anesthetic if we are going to give it with adrenaline. Number 2, now local anesthetic, because it stay at that particular site, अब ये क्या है, अगर वो वहीं पे रहेगा तो systemically absorption will be less, systemic toxicity will be less. This is another advantages. Systemic toxicity of local anesthetic will be less. Now the third thing is, because of vasoconstriction, if we are doing any surgery or any procedure, then what will happen? The blood loss will be less. So it is going to provide decreased bleeding will be there. So decreased bleeding. So it is not only like addition of this one is only advantage ही है, इसके disadvantage नहीं है. There are few disadvantages, they are also there. Now what are the disadvantages? अगर vasoconstrictor है, blood flow नहीं हुआ, तो pain will be there, pain at the site. Number 1 this, ठीक है. Number 2 healing, there will be poor healing. Third thing is, आपने adrenaline दिया, adrenaline, if this is absorbed systemically, so cardiovascular side effect will be there, like tachycardia will be there, palpitation will be there, there may be rise in blood pressure, okay. Patient may have arrhythmia, patient may be, there may be precipitation of the angina, मतलब कोई भी cardiovascular patient को problem हो सकती है. So then what are the other disadvantage of this one? Suppose you are doing the procedure with the end arteries, जहाँ पे end arteries है, like आपका कह लो toes, fingers, penis, ear lobules, ठीक है, ये वाले structure, these are the region where the end arteries they are there. Then what will happen? Because of the vasoconstrictor, they are going to cause the intense vasospasm and patient may end up having a gangrene. So these are the disadvantages if we are going to add the adrenaline with the local anesthetic. So what we can add instead of adrenaline, यहाँ पे अब आता है, we can add a vasopressin, that is phalipressin. suppressive can be added. Okay. So this is a very commonly asked question. Explain why the local anesthetic they are given along with the adrenaline. Now another factor, the presence of pus or inflammation. So whenever pus or inflammation it is there, then what will happen? Because of the pus and inflammation, they are going to decrease the pH. If there is decrease in the pH, then what will happen? Local anesthetic, so क्या medium क्या हो जाएगा? Decrease pH, there is a medium will be acidic. Local anesthetic आपके क्या हैं? They are the weak base. Then बहुत ज़्यादा acidic हो गया, then what will happen? It will remain ionized. So ionized fraction cannot cross. So presence of pus and inflammation, they are going to decrease the action of this local anesthetic. So vasoconstrictor, big yes, but pus and inflammation, tabhi whenever there is a pus or inflammation, we do not use the local anesthetic to decrease the pain or anything to produce the numbness. We always have to drain. कहीं पे भी इन्फ्लेमेशन या पस कुछ भी होता है, वी नेवर यूज अ लोकल एनेस्थेटिक ड्रग. दिस इज द रीजन बिकॉज दे आर नॉट इफेक्टिव बिकॉज ऑफ द डिक्रीज pH or acidic media. They are the ionized and they are not absorbed, so they are not effective. So these are the questions on the basis of this. Explain why local anesthetic they are given along with the adrenaline. I have told already all the points. Then the second question is local anesthetic they fails to afford adequate pain control in the inflamed or infected tissue. जहाँ पे inflammation है और जहाँ पे पस है वहाँ पे the local anesthetic they fails to afford the adequate pain control. Now what kind of the question can be asked here? The important MCQ is adrenaline that is added, ये पहले बता दें, adrenaline is added to lignocaine to prolong its effect and decrease its absorption. अब in a ratio of what? ये important है, ये आपको you have to mark it up. It is a correct choices 1:2 lab. Yes, this is the correct choice. So this finishes my topic. Hope you understand the mechanism of action of local anesthetic. If you like my video, so kindly subscribe my channel and put up your important suggestion in the comment box.